Good afternoon, and welcome to our fourth edition of the Ohio State University's Office of Diversity and Inclusion's Driving Change webinar series, a dialogue and discussion format for our corporate and institutional partners focused on diversity, equity, and inclusion in institutions, places of work, and corporate America. I am Kurt Ely, Executive Director of the Ohio State University. Before we begin, I would like to share a few brief logistics around today's event. First and foremost, we encourage your questions. They will be accepted using the Q&A function during the course of the webinar. Requests for follow-up can also be posted in the same manner. Future webinars are being planned for March and April and into the calendar year, so please be on the lookout for email invitations for those dates. As a reminder, this webinar is being recorded and will be available following today's event. Without further ado, I would like to introduce the host for this series, Dr. James Moore. Dr. Moore is the Vice Provost for Diversity and Inclusion and Chief Diversity Officer for the Ohio State University. Dr. Moore will introduce today's esteemed panelists, and today's discussion will address the topic of overcoming healthcare disparities. Dr. Moore, the program is yours.
Thank you, Kurt. It's a pleasure to be here. It's always a pleasure to work with you. On behalf of the Office of Diversity and Inclusion and the Office of Corporate Relations, I want to welcome our audience to this panel, to the fourth panel that we, as a part of the webinar series, Driving Change. Today, we have a pretty fruitful and exciting panel scheduled to be focused on healthcare. I just want to give you a little highlight about the Ohio State University and its strong commitment to diversity, equity, and inclusion. On May 25th, 1970, the Office of Diversity and Inclusion was founded, formerly the Office of Minority Affairs. So we're celebrating 50 years of existence. This office has a rich history, and it's one of the oldest, largest, and most comprehensive Office of Diversity and Inclusion in the country. One thing I like to share with the audience that last semester we had over 2,500 scholars who made the Dean's List, so we're very excited about that. We've impacted and we've created an apparatus for academic excellence for individuals who matriculate at the Ohio State University. Our students go forth and do amazing things, and I would be remiss if I didn't highlight that kind of excellence that we have at the university. That's what created the webinar series. The impetus for creating the webinar series is to have a meeting of the minds to highlight and showcase the diversity, equity, and inclusion efforts at the Ohio State University, as well as to stimulate the thinking of our corporate partners, as well as future corporate partners, how we may work together. I'm very excited about today. As you can probably imagine, we have two wonderful panelists with us today. It's hard today in the era of a major global pandemic not to talk about healthcare and as well as those individuals who do not have access to the healthcare system that we have in our great nation in the United States. Our first panelist is Dr. Hal Paz. He's the Executive Vice President and Chancellor for Health Affairs at The Ohio State University. As you can imagine, he wears many hats. That's not enough for him. He's also the Chief Executive Officer of the Wexner Medical Center, a highly acclaimed medical center. We're just delighted to have him in our presence because I know he's a very busy person, but he will certainly share some wonderful insights. We also have Miss Monique French. She's the advisor for patient advocacy and professional relations at Eli Lilly. Both of their bios are so extensive, so we're going to encourage you to go to their website so we can have more time to engage these wonderful panelists. Well, that's enough pleasantry and a prelude to the panel, but I'm going to ask just big open question to get us started. But just like what Eli indicated in his remarks, Kurt noted in his remarks, we would love for you to submit questions through the Q&A function. We would like this panel discussion to focus more on the questions that you submit to us rather than our pre-scripted questions that we've already developed. The first question that I would like to present to the group, and it's just to get us started. What is the current state of healthcare disparities? Dr. Pauls, would you care to respond to that question?
It'd be my pleasure. And let me just begin by saying, Dr. Moore, that it is truly an honor to be here with all of you and to have a chance to be on this webinar. I'm only sorry that we're doing this over Zoom and not in person. And I look forward to a day, hopefully not in the very distant future, where we can gather again in person. So let me start with your question. You know, as a major academic health center, I believe that the Ohio State University Wexner Medical Center and our health science colleges, and I would mention that we have 7 phenomenal health science colleges at Ohio State, virtually creating the largest academic health science campus in the nation with approximately 10,000 students. That we have a major responsibility to set examples of anti-racism and to correct inequities that exist. It's our responsibility as a very large health system that cares for roughly 2 million visits a year of patients, 7 hospitals across this region, and many ambulatory care facilities across central Ohio. But in addition to that, this very large educational responsibility that we have at the university, as well as enormous amounts of cutting edge research in terms of new types of treatments for COVID, as well as preventing COVID through its spread, preventing its spread. But as we think about the work we do, we also have to look at the issue of health equity and inequities, and we have to look at the issue of how this impacts our ability to make sure that every individual is able to live a healthy life, to be well, and to not die a premature death. And we know that we have to start this process by examining ourselves and finding ways to improve education, engagement, look for opportunities for funding, and to look at policies and practices within our own walls as we fund these initiatives. And it starts by asking ourselves at the Wexner Medical Center and the health science colleges, we are 30,000 strong. That's how many individuals work at the Wexner. And if we work together towards this goal, we can in fact create positive change. And from there, we know that we're not only setting an example, but we're leveraging the expertise and influence of a leading academic health science center and these 7 health science colleges that fortunately are part of one of the largest universities in the nation, one of the most preeminent universities in the nation, to lay a groundwork both nationally and globally to help others address issues of racial disparities and health inequities through our clinical practice, through our research and our education. We're one of the first academic health centers to create and implement an anti-racism action plan to improve and address health equity. And I'm incredibly proud of the progress that we continue to make as we work to push forward an anti-racism movement. We've assembled a diverse group of leaders to serve on our anti-racism oversight committee with representation from across the medical center and the 7 health science colleges. This group will guide our work to ensure diversity and inclusion and to make sure that it's integrated across all aspects of our organization, from education and training to community engagement to patient experience, but also policy and advocacy, as well as our own employee engagement and communication. We've assembled 9 anti-racism action groups that will create and support strategic initiatives for implementation for cross-section of more than 160 champions that are working to drive these efforts based on our organization's passion, but also our desire for willingness and change. We think this is incredibly important as we move forward. And a lot of work here that's going on is happening now for the past, since last year and into this year. This plan is moving forward in ways that are really making a difference. One of the things that we're focusing on is can this be used as a model by other health systems and organizations and employers to create opportunities to combat structural racism? We're looking at ways to define and introduce actions to create an anti-racism movement within our own organization, but also much more broadly. And we believe this is a unique opportunity for us to focus on community programs across the region. We can't just look internally. We have to look externally, and we have to partner with communities. We have to partner with employers and organizations and corporations and nonprofit groups if we're truly going to be successful. I would just want to maybe wrap up your question with a couple of core tenets. One, we have to elevate our commitment to creating a diverse and inclusive organization at all levels. We have to equip and engage our faculty, staff, students, and other learners, our patients and community leaders, to have the tools and the opportunities to learn and participate in anti-racism efforts. And we have to empower our clinicians, our educators, our researchers, and our students to, wherever possible, address issues of racism, poverty, and the social determinants of health. We know if we continue to do this, we can make meaningful progress. We know this is so important to our core mission because we went and defined racism as a social determinant of health. And we know that social determinants of health have an enormous impact on the likelihood that someone will lead a full and healthy life and will not die a premature death. And for those reasons, we think this is incredibly important work, and that we have to look outside our walls to be able to engage in ways to make this a reality.
Thank you. Ms. French, what is the current state of healthcare disparities?
Thank you for that question. And allow me to be a part of this panel.
Can't hear you. We can't hear you.
Hello?
We can hear you now.
Okay. Sorry about that, you guys. I know we've all faced technical difficulties as we go along this journey within virtual meetings. So I was saying that I echo Dr. Paz's comments, and thank you so much for allowing me to be a part of this panel. Wish that we were in person to have this conversation, but given the circumstances, have it virtually. So thank you for the question about the state of healthcare disparities. We know that people of color are often skeptical and mistrustful of medical research as a result of medicine's dark history, unethical experimentation with minority populations, such as the unjust syphilis studies on Black Americans. People of color also experience barriers to accessing quality healthcare, driven by socioeconomic challenges, as well as bias and discrimination in medicine. And less access to healthcare means less access to doctors who typically connect patient volunteers to pharmaceutical companies for trials. The COVID-19 pandemic has amplified existing health disparities within a disproportionate impact on Black Americans and other racial ethnic minority populations. All of these factors add up to racial ethnic minority populations underrepresented in clinical trials, meaning that specific outreach strategies are needed to ensure equal access and build trust between researchers and racial ethnic minority groups. Minorities make up about 40% of the US population, but less than 20% of participants in key clinical trials that lead to the approval of new medicines. This low participation is itself a health disparity because clinical trials give patients access to care and hope for healing. Lilly continues to engage in efforts to involve a more diverse range of participants in clinical trials. Achieving diverse representation in our clinical trials require clear, measurable goals. And I just want to go over a couple of goals with you today. Number one is to create a robust clinical trial strategy and reach diverse populations. To achieve diversity within clinical trials, our U.S. clinical team aims for each trial's participants to match the U.S. patient population that might use the trial's medicine once it's approved. Across clinical trials globally, we identify and address barriers that keep underrepresented populations from participating in clinical trials. Our second goal is to intentionally select a diverse range of trial sites and investigators. We aim to recruit more clinical trial investigators and external advisors who represent women and racial and ethnic minority populations, with the ultimate goal to have our investigators and advisors match the U.S. population in terms of gender and race and ethnicity. Lastly, increase diverse representation through partnership and collaborations. We collaborate with patients, patient advocacy organizations, regulatory agencies, health care professionals, and community organizations to identify, implement solutions that will result in diverse representation to improve health equity and generate evidence to support better patient outcomes. These goals reflect our commitment to achieving greater diversity in clinical trials to ensure that communities of color have fair access and representation in our clinical research, and to help develop innovative medicines to make life better for people around the world.
Thank you. Ms. French, I want to come back and then I'll ask Dr. Paz to follow up. What is the role of corporate America in mitigating or eliminate some of these health disparities? And what role has your company played?
I think that's a great question. At Lilly, we've looked directly at areas where we can have impact, such as increasing diversity within clinical trials. Recently, our company announced a $30 million limited partner investment in Unseen Capital Health Fund, a newly formed venture created by racially diverse and historically underrepresented leaders that is intended to identify, fund, and support underrepresented founders of early stage healthcare companies and those building solutions for marginalized communities. The $30 million investment by Lilly is a component of our company's racial justice efforts and provides a mission-aligned capital to the fund. The Unseen Capital is now active and investing, and with Lilly's investment is well on its way to achieving its target of $100 million. African Americans and other minority communities are frequently unseen by the U.S. healthcare system. Likewise, diverse business founders who understand and live the healthcare concern of these communities are often unseen or overlooked by traditional institutions that allocate capital. The Unseen Health Fund intends to address challenges by investing up to 50 early stage healthcare companies operated by these underrepresented founders. And these founders many times have developed insights and connections in the challenges presented by traditional healthcare systems, particularly at the intersection of digital health and social determinants of health. The pandemic has reinforced our understanding that there is unequal treatment and unequal access to healthcare in underserved communities, made worse by a lack of financial investment for promising ideas that rise up within these communities. So at Lilly, we're committed to addressing systematic inequities in health and business that too often have devastating effects on the lives of historically marginalized people.
Paz, what role can corporate America play in helping mitigating these health disparities? It's clear you mentioned some of these things, but I would imagine you have some more specific, concrete ways in which they can engage in your efforts.
Yeah, so Yeah, and I would say specific to us at the Wexner Medical Center as a large employer in Central Ohio, these are lessons that, we take up every single day that we come to work. And I think first and foremost, it starts with ourselves, with the diversity of our own workforce. To be specific, I'm enormously proud of the fact that the Ohio State Wexner College of Medicine, the College of Medicine at the Wexner Medical Center and at Ohio State University ranks #2 in the nation among all medical schools in terms of the number of African-American medical students when you exclude the 4 traditionally Black medical schools in the United States. 22% of our incoming class of students are from underrepresented backgrounds. 22% of our College of Medicine leaders are women. Last year, Forbes ranked the top most diverse employers in America, and that's corporate employers and hospitals and health systems. #1 in the United States was Procter & Gamble. The Wexner Medical Center was ranked #4 in the nation in terms of diversity. We have to start within ourselves and engage in these conversations in purposeful ways. And it's incredibly important to have a strategy, but strategies are only as good as the people that engage in them and undertake them. And we know that if we have a diverse workforce, if we have a workforce that is representational of the communities we serve, we're going to have a greater chance of success in implementing these vitally important programs. And then last but not least, we have to be able to provide the funding and the support to continue them both internally and externally. If you think of topics like vaccine hesitancy, for example, there are huge opportunities to create programs in the communities where there are issues and challenges based on topics such as structural racism, where there are underrepresented population that are looking for the support that they feel they can trust and will give them the healthcare needs that they need. I'll give you an example. And this gets back to what Monique had just said a minute ago, which is we know that there's a huge impact of social determinants of health into the outcomes in communities. Here in the greater Columbus area, for example, if you live in Bexley, one of our communities bordering Columbus, we know that the average life expectancy is 85.4 years. But Bexley is largely an affluent white community. Go 1 mile up the road, literally 1 mile up the road, you are in our near east side of Columbus community. And the life expectancy there, mostly poor, mostly minority, is 67.1 years. That's over an 18-year gap. These issues such as housing, transportation, poverty, education, food insecurity, these are the things that have an enormous impact on the likelihood that someone will live a full life, will not die a premature death. And these are the things that I believe corporations or health systems have to engage in addressing if we're going to make meaningful change. Healthcare per se, this thing that we do here at Ohio State that I'm so proud of, attributes to maybe only 20% of premature death. It's these social determinants of health that attribute to about 60% of premature death. And it's only through corporations and employers engaging in local communities to address this, to build trust, to make sure that minority communities engage and trust the solutions that we offer and that we invest in those solutions and we invest people in those solutions, can we have a meaningful impact. Some of the programs, and you asked Dr. Moore for some specifics. So just take the most recent set of challenges we face with the pandemic and COVID-19. So we've distributed community care kits in the Near East Side. We offer free flu vaccines there as well in local communities. We're in the process of setting up a COVID vaccination area, as well as we're rolling into Tier 1B in the state of Ohio now, because we know there are challenges of access to care. We've identified leaders at the medical center that reflect the diversity of these communities, particularly the under communities we've served, and made sure that they had a prominent role in being among the first to be vaccinated, because they're role models for communities that, quite frankly, are challenged, and there have been challenges created in terms of the trust that they have in the systems that are developed to offer care for them. You know, Monique had addressed this as well. So how do we build that trust? How do we address vaccine insecurity? It's by going in the communities. It's by handing out COVID care kits. It's by educational programs, pamphlets, and those COVID-19 care kits that we can do that. There are longstanding relationships. We have one called Partners Achieving Community Transformation, or PACT. And this is a program that addresses socioeconomic factors that influence health in our Near East Side neighborhood here in Columbus. Again, that's the community I referenced before that has over an 18-year difference compared to a more affluent community just down the road from them. So it's only by engaging directly through PAC in that community do we feel we can really make these meaningful changes that are so important and so necessary. Food security, I mentioned that a minute ago. We know that it's really through initiatives like our partnership with the Mid-Ohio Food Collaborative, by creating something that we call our Mid-Ohio Pharmacy, thinking of food as a prescription, where we can engage in healthy eating, healthy diets, allowing us to address challenges such as metabolic disease, obesity, which are such important contributors to premature death. And if someone lives in a community where there aren't even places to go shopping, and the only place they can get food from is a mini mart attached to a gas station, where there's not fresh produce, where there are not the things that are so important, it makes it so much harder to do that. So things like our Mid-Ohio Pharmacy program become incredibly important. One more thing, and I want to make sure we have enough time for other questions. Access to care, so important. So we've gone from 50 telehealth visits a month here at Ohio State to now 2,800 a day from the beginning of the pandemic, because we were not able to provide care in the traditional inpatient sites as outpatient sites because of the pandemic. And that's been wildly successful. We know that broadband is ubiquitous across our city and across the region in most cases. But what's challenged is the technology to access it. If you can't afford an end user device, if you are an elderly individual and you don't even understand how to use the technology, even if you have it to access it, then all this work is not going to achieve the end result that we had hoped for. So we're spending a lot of time on addressing education, working in communities to address these issues of access to new types of approaches like telehealth, because we think that's so vitally important. It can level the playing field. It can allow us to make improvements in overall care. And then last but not least, the work we're doing with mobile health, getting vans into local communities. One of our vans makes frequent trips to the Near East Side to bring healthcare to the community, as opposed to expecting the community to come to us. Last but not least, the work at our our East Hospital in the Near East Side, and the work that goes on there at the hospital, at the clinics, to address health disparities and care delivery in the communities that have real need. And we're going to continue to grow and expand that. We just invested over $20 million in creating renovations and upgrades to Ohio State East. That hospital is vitally important for a community that has many health challenges, is exceptionally diverse, and we feel it's exceptionally important to offer state-of-the-art facilities there that mirror the most beautiful facilities we have anywhere else in the Wexner Medical Center hospital system.
Thank you. Ms. French, what is the role of higher education in the work that you were doing at Eli? Your mic is muted.
Good, good. That's a very important question. I think we continue to partner with various different partners, such as higher education. I think right now, as we think about some of our short and our midterm steps, action steps, we think about what we can do right now, and we're focusing that on reducing barriers and enrolling more minorities into clinical trials.
Thank you. I just want to encourage our audience to please submit your questions to the Q&A function in Zoom, but I'm going to present a question that we received from our audience, and I'm going to direct this to Dr. Paz. How are health disparities addressed at the administrative/policy level? How are health disparities addressed at the administrative/policy level?
Well, I think that it starts with our people and our workforce, and to make sure that at the administrative level, we have a diverse workforce of individuals that include broad representation, including particularly underrepresented community members. And it's one thing to say, you rank fourth in the nation in the overall workforce of 30,000 individuals, but if that's not reflected in the leadership, that's a huge challenge, because as you just described, James, it starts often with the leadership, particularly as we think about administrative and policy areas. So whenever I launch a search for a leader at the Wexner Medical Center, and we form a search committee, we think very carefully about who are the members of that search committee. Does that search committee reflect the diversity of our organization? If everybody on that search committee looks just like me, it's unlikely that we're going to have a group of individuals that think broadly about the types of talent and people that either are within our organization or we can recruit from the outside. So that's the first step, and we spend a lot of time thinking through that carefully. The second thing we do is when we bring the group together, we do implicit bias training, because I know that it's something we do frequently at the Wexner Medical Center, but it's something we have to remind ourselves of when we start a search, to make sure that no one's bringing their preconceived notions with them. They're leaving whatever baggage there is way back in the past, and they come as strategic and fresh thinkers about talent that we can bring to the Med Center that addresses all aspects of our mission. Sure, we want outstanding administrators, we want outstanding clinicians, educators, and researchers, but we also want outstanding individuals that think decisively and strategically about advancement and addressing issues of diversity, inclusiveness, and disparities. If those individuals are not at the table, what's the likelihood that as we do the search, we're going to think broadly to find candidates for these positions that will allow us to move our organization forward? And I am very proud of the success that we've had during my time here, which is nearing 2 years now at Ohio State, in terms of our ability to recruit individuals to our institution who reflect that diversity. We obviously have more to do. The last thing I want to tell you is we're patting ourselves on the back. But if we don't start here and we don't continue that process and build off of it, because we know that success will then create future success, because it's not just a bunch of talk, but it becomes a credible initiative that others pay attention to and say, this is the kind of organization I want to be a part of and I want to join. And I think that's incredibly important. Then you put those people together in a room and you say, we need to talk about policy. We need to talk about it, how we organize and administer ourselves. And when you have a group of individuals that reflect great diversity around the table, the thinking starts to come together in ways that makes sure that is in fact what happens, as opposed to something we just talk about happening.
I appreciate, Dr. Paz, I appreciate the work that your team is doing. And I must say, I feel very comfortable saying that many of the students that now matriculate into med school, they've been shaped by our office, and I just appreciate all the leadership and you shattering some of the myths and the challenges. Your leadership is an indication of what can be done and what could be replicated around the country. Ms. French, you talked about representation in clinical trials as well as in the other areas within the domain in which you work. What are some of your best ideas in diversifying the enterprise in which you work?
I think one thing that we've done is that we must confront racial injustices now, right? And we must confront them head on. And we are publicly committed to addressing systematic inequities to confront African Americans every day. And there's a spirit of transformation underway, and we must answer that call to action if we're going to create lasting change. And so, along with other companies, we've joined with Anthem, Citizens Energy Group, Cummins, IU Health, Pacer Sports Entertainment, Roche Diagnostics, Salesforce, and the Business Equity for Indy Committee. We've joined the Indy Racial Equity Pledge. And let me tell you what that says. It says we pledge to take meaningful action to address issues of racial equity and justice within Central Indiana. And as leaders in our community, we must hold one another accountable for creating short-term and long-term change for African Americans. And we pledge to share this progress towards a goal of racial equitable community. And some of those pillars include health, they include prosperity, and they also include education. And we know that together that we can all create change.
Thank you. Dr. Paz, if you had one request and you were a potential funder, say, hey, I want to invest in some of your many endeavors, but I just want to invest in the one that is going to move the tide. What would be that initiative? You named a number of things, but that just one, and why did you choose that one initiative?
I think that clearly the investments in allowing us to have an impact on the communities we serve are so vitally important. And we know these have to be public-private partnerships. As a public institution, there is so much that we have to do and can do and will do. But when we partner up with corporations who share our vision, we can only be more successful. And for us here at Ohio State and at the Wexner Medical Center, so much of the work we do is predicated on partnerships. Again, take the COVID pandemic. The progress we've made to date are in fact the results of working closely with companies like Lilly. I mean, our infusion center, our monoclonal body infusion center, we've infused over 1,000 patients now. We're probably one of the leaders, among the very top leaders in the nation in doing this work. These are things that we've done in partnership with industry. That is vital to our success. We want our graduates to be anywhere in the university, to have wonderful jobs to allow them to fulfill their professional aspirations and to support their individual aspirations. And so it is so vitally important. The biggest challenge I have, though, I have to say with regard to our topic this afternoon is, I'm so proud of the work that's been done here, and we've been able to advance, develop professionally a number of incredible leaders, people of color. And the challenge we have now is there are a significant number of individuals that have developed national and even international reputations. And you know what happens then? It's trying to keep everybody here. And part of it, I have mixed feelings about this. When I see one of our superstars in the administration here at the Med Center move to a global company, for example, to take on a global role, I'm enormously proud. But at the same time, we work so hard to develop and to bring the talent we have here forward. It's now, an opportunity to start again on one hand and to take pride in someone's professional growth and development on another. But it's an ongoing project, and we're proud of the attention. But on the other hand, we're working really hard to keep our extraordinary talent here. And that's something that, when I think of funding, investing in these people so they want to stay at Ohio State, is really important. And we're going to continue to figure out where we can find the funding. And again, I think partnerships, working with industry is yet another way to do that.
Thank you for your candor. And for those of you in the audience, if you're looking for opportunities to make investments that will tremendously make a difference, please reach out to Dr. Paz and his team, because I'm sure he will welcome those conversations. I know, Dr. Paz, I just recently heard that one of your top faculty members is leaving to take a major position, but that person was shaped by our office. And so I want people to know, sometimes, we never know what people will become. That's why it's very important that we make these initial investments where people can make a groundswell in their lives and their careers. And so I think that's the challenge that we all have at the institution at Ohio State. But I think we have enough smart people at the institution and enough problems in Columbus and beyond that I'm sure we can figure that out. This is another question. And again, audience, I want to encourage you to submit your questions to the Q&A function. And either one of you can respond to this question. The question is, in resolving healthcare disparities in terms of minority recruitment for administration, for practitioners, nursing, administration, which methods have proven to be the most effective?
Can you repeat the first part of the question, James?
Sure. In resolving healthcare disparities in terms of minority recruitment, which methods have proven to be the most effective?
Yeah.
I can take a stab at it, and thinking about, as that kind of pertains to clinical trial recruitment, I think one of the things that we think about is what are some immediate changes that we can do right now? And for me, that's our company, the way that we're looking at it is how can we locate clinical trials as closer to patients' home, knowing that transportation can be a barrier. The use of virtual visits, now that we understand the use and the impact of virtual visits now, knowing clinical trial check-ins via video chat can reduce time and travel burdens for patients. Our second thing is collect less data. Clinical trials often require a lot of diagnostic tests and data collection from participants in hopes for it to be used in useful ways, but they also have extensive testing, which creates a barrier for many people to participate in trials. And so instead, we should focus trials to gather only the data that's needed to really meet our scientific objective. And then lastly, reduce eligibility requirements. The ideal way to study the impact of a medicine is to give it to patients with no other illnesses than the one that's being tested. So pharmaceutical companies often exclude patients that have additional conditions. And this can disproportionately exclude minorities who have multiple health conditions at higher rates than their counterparts.
Dr. Paz, would you like to respond or have any ideas?
Yeah, again, I think it's really about culture. It's about having data to support the culture. And I agree that we don't want to have overly complex data that, detracts from what it is we're trying to achieve. But I think being able to support the message with facts that reflect the values of the organization and that are meaningful, because individuals having to make decisions about where they want to work and where they can achieve success are going to have to make these decisions based on the reality of the circumstances. And certainly what the leadership has to say, what the individuals who are trying to bring them on board have to say is very important, but they want to see the evidence to back it up. And then last but not least, they want to see the investments being made. If we don't invest in these areas, both inside the organization and outside the organizations, frankly, it's just a lot of talk. And one of the things that I pledged to do as part of our anti-racism action plan was to provide transparent data to our communities so that in fact they can see the progress we're making. If they don't see that data and that evidence, why would I expect them to believe what we say? It's just a bunch of words. So we've said that we plan on doing that. We're setting goals. We plan on showing the results of this initiative broadly so we can demonstrate where we've had success and, quite frankly, where we need to spend more time and make more investment to achieve the results and the outcomes that we aspire to achieve as part of our anti-racism action plan.
You all named a lot of wonderful things, and I'm sure the information that you provided, people are taking copious notes, and they're wondering to themselves, how can I be connected? How can I find more information? You know, Dr. Paz, how can others be plugged into the work you're doing? How can they get more information? Please share with us.
Sure. So first of all, we have a lot of great information on at our Wexner Medical Center website, and of course, our university has great information on the overall university website. We have individuals who their main job. We created a new position this past year, into 2020, around community outreach. Because we feel that having someone dedicated to engaging communities, our Near East Side community, other communities that have enormous need, we need to have full-time leadership who just think about that work, in addition to all the individuals who are working on these initiatives at the ground level, at the various programs at hospitals like East and in other locations at our clinics, but someone that can engage with partners here across the state and across the nation who want to partner with us. And we've had a number of requests now lately for us to work with national groups around outreach and engagement. And that's what this new position focuses on. And then on the other side, we've recruited a new leader to the institution whose focus is on strategy and transformation. And the transformation aspect of that role, which is the overwhelming largest part of the role, is to engage with corporations and partners to work on ways that we can transform this large academic health center through creating these long-term partnerships with businesses who we have mutual alignment with to create new types of innovation and opportunities for growth, and to have an opportunity to make a difference in the lives of those that we serve. So those are two positions that we've just created. We've put people in roles this year, and we want to see them as leaders for us to continue to engage broadly with corporate and community partners so that we can have this impact that is so vitally important.
Thank you. Ms. French, how can others get plugged in and learn more about some of the things you highlighted today?
Yeah, thank you for that question. You can definitely go to lilly.com. We have a wealth of resources that really show what we're doing in this area, how we can increase diversity within clinical trials and other initiatives that we have for racial justice pledge. And then you can also go to the Indie Racial Equity Pledge.com. That really shows a partnership with other corporations within Central Indiana. It shows the pillars that we talked about. And most importantly, like Dr. Paz says, it shows those measurable objectives that we said that we're going to do. So not just us, but other companies as well as part of this pledge. So I encourage you guys to visit that as well.
Well, on behalf of the university, I can certainly state that we would love to see a stronger partnership with Ohio State University in Central Ohio. I'm sure Dr. Paz has some ideas in which he can integrate you in some of the efforts that they're engaged in. This has just been a fruitful conversation, one that I think will serve many dividends for those who were able to engage in this webinar. Just any prevailing thoughts, last words of wisdom that you all would like to share before we depart? We'll start with you, Ms. French.
You know, one thing I would just like to end and say is that while we've made progress, right, in trying to increase clinical trial diversity, is that we still have more work to do. And we've laid out a plan, an action plan on how to address that. And our industry is committed to working on those efforts to make sure all people are representative. The coronavirus has demonstrated that when any of us is at risk, we all are. So I just appreciate the opportunity to share what we're doing and look forward to more conversations.
Thank you. Dr. Paz?
Well, I would just echo that, and from our perspective, say that clinical trials is so much of what we do, but at the end of the day, that same set of issues translates to vaccine hesitancy. And we all know that if any part of society is not going to be vaccinated, it puts them at enormous risk, but it puts all of us at enormous risk because we won't effectively stop the virus once and for all. And therefore, it's in everyone's best interest as a nation to address thilese issues. So it really demands that we work together on these things, and the opportunity to work with companies like Eli Lilly and other corporations is enormously important to us. And I would say that this program is just another chance to discuss why these things are so important, to put some facts behind it, and then look for opportunities to do even more in the future.
I'd just like to thank you for taking time out of your busy schedules to be with us today. You imparted much wisdom and insight. Your sage perspectives will certainly go far with all those who participated in this panel. We look forward to having a continuous dialogue. And Ms. French, Ohio State, as I said, we extend an invitation for a closer relationship in some way, in some form. I thank everyone, our audience, for signing up. We encourage you to go to the website. We have forthcoming webinars scheduled. And also, I just encourage everybody to go to the Office of Diversity and Inclusion website, as well as the Wexner Medical Center website, because both entities highlight a number of DE&I activities going on across the university enterprise. I thank you for your time, and now I'm going to give the floor back to my dear friend and colleague, Kurt. Kurt Ely.
Dr. Moore, Dr. Paz, Ms. French, thank you so much for your participation today and the leadership that you're providing on this important issue and the other issues that were discussed. I'd like to also thank the participants of today's webinar for sharing part of your day and tuning in to help build a greater understanding of the challenges that we all face collectively. Each of you will receive a follow-up email with links to the recorded webinar, as well as the contact information for any requests that you have for follow-up. So thank you for sharing part of your day with us. And on behalf of the Ohio State University and Eli Lilly, we appreciate your time. Have a great day.